And I said, come on over, you'll say.
All right. Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. I'm your host, Dave Kuzminski. We are live here in the Town Tech Educational Podcast Studio at Portland High School, and this is going to be our episode number 47. And with us in the studio is the Commander-in-Chief, our first Selectman, Mr. Ryan Curley, and, of course, our frequent flyer that comes in remotely all the time, where we have our Chatham Health Director, Mr. Russ Melmed. So, welcome, guys. How are you?
Doing well. How are you, Dave?
Just gorgeous. It's actually a very nice day out there today. The temperature is, pretty pleasant,
Yeah, the sun is shining. It's not 8 degrees out. I mean, how about that?
Yes, that's a good thing, So, all right, you guys all ready for the Super Bowl? I want to get this out on the table. Okay, who's picking who?
Okay, I'm going with the Rams.
You're going with the Rams, okay?
But I'm just really what I'm hoping for is a good game. I really don't care about either of these two teams.
Yeah.
I want it to be a close, clean game with lots of points that comes down to something happening miraculous at the end. That's what I'm going for.
Well, I tell you, the playoff games were just like that. My God, they were all decided pretty much by field goals in the last 2 minutes.
Yeah. I'm going for the Bengals, but I certainly do like Matt Stafford, and I honestly, it's tough. I don't really have a dog in this fight, but I'd be happy with either team this year, which is unusual for me to say. So
yeah, for sure. So
yeah, I'll be happy either way. I'm picking the Rams, but I'm not rooting strongly for either. That's for sure.
Well, that's the thing. You get to a point where the Browns haven't been here, I don't think, in a long time.
I can't remember. No.
Well, the last time the Bengals were in the Super Bowl was that was 1990, 89, was it?
Yeah. Yeah.
Was that right? I mean, they lose to like the 49ers or something?
Something like that. Yeah.
Way back. That's the only time they were there.
It's crazy. So anyway, all right. So let's get on with business here. And Ryan, move your mic over just a little bit so we can get you a little bit hotter there. That's it. Okay.
All right. How's that?
Fantastic. Okay.
Great.
All right. So, Brian, why don't you start off and give us the state of the state? Now, the governor gave us the state of the state yesterday, so we need you to give you the state of the town today.
Well, we are busy in the town of Portland. Things are moving along. You'll notice Brainerd Place continues to have the demolition work done, and work is underway there. We're looking forward to them being able to move forward with their plans, and we're looking forward for the construction to get underway. Hopefully, we'll get those permits in to the land use office any day now, so they can keep moving forward with that.
Yeah.
But also, Brownstone Avenue is getting ready for some activity at 248 Brownstone Avenue. That's one of the 3 brownfield parcels that the town purchased back in 2019.
Yep.
And so we're excited that the company, Enviro Consultants and Recyclers, will be beginning the remediation work. We believe it will begin in March. And once they do that, it really isn't going to take too long. I think that they even said they might be done by the end of March. So certainly by early April, that property may be remediated. And that's going to be part of our economic development in town. And we're hoping that we'll have a public-private partnership that we can put in place. I know that Mary Dickerson has been working hard on an RFP to go out and find a private partnership, and so that will be becoming issued soon. I sent it out to the Board of Selectmen to review. I wanted them to take a look at it. I personally think it's a great RFP, and I just hope that we get a lot of activity from it so we can pick the best choice for the town. But certainly that will be an economic driver for town, and that's really the point of it. We still have those other 2 parcels there. We have 222 and 230 Brownstone Ave, which are the parking lots, really, that the Exploration and Discovery Park uses currently. And we're going to have to get that remediated as well. So the grant that we had from DECD, it covers enough to remediate the 248, but we're going to have to look for alternative funding solutions for those other 2 lots. So we might be taking a look at maybe applying for some more brownfield grants.
Sure.
So we'll see how that goes, but that's exciting. So it's good to see. There's a couple other grants that are in the works. I know Dave, you serve on our Water and Sewer Commission.
Yep.
And that, as everyone in Portland knows, water is a hot button topic these days.
Oh, absolutely.
And so we had a RFQ go out, request for qualifications, and after that we selected 4 firms to move forward with an RFP.
Yep.
And coming up, beginning next Tuesday, we're going to start interviewing those 4 firms. So it's going to be on Tuesday, we're going to interview one. I think that's the 15th. And then I believe the 22nd, we will interview the other 3. Mm-hmm. And so we have a panel for that. And I think that this is going to go a long way into moving, the ball forward and keeping this going, because we really don't have a lot of time.
2026 is when the contract is up and so forth. So we got to be in a position to, do something.
The good news is that we did receive MDC's rate increases this year.
Yeah.
And it was a 1% rate increase from last year. So that's the silver lining, is that, we're not getting hit with another, 8 or 10% increase. It's, so that's okay, but obviously we still have to.
The year is young.
The year is young, and you never know, but that's good. So we're working on that. I'm also working on hopefully a couple other grants that we can talk about once we get farther along with them. And then the other thing that I'm working on is the budget, and that's really the priority for February.
It is that time.
And I got to say, we're coming in. We've had a reevaluation, so a lot of people who are listening may have gotten those letters in the mail from the assessor explaining that their property most likely went up in value since the last revaluation.
Yes.
And so, with that, and with the, I just read, I think it was 7% inflation that we just had in the past year over year or month. I just read the headline this morning, but certainly the budget's going to be a challenge, because we certainly want to keep costs in check, and we want to be prudent with the budget, but we also have needs and there's a lot of areas, long range capital, capital improvements, and so that's what I'm working on with Tom right now, and we'll hopefully get some good numbers that we can bring forward to the town and the Board of Selectmen, and we can move that forward. So those are the big things I'm working on, and I just want to say part of the what goes along with that budget is I just got off a call with our superintendent, and we are working on a plan for the replacement of that track that's right here at the high school.
Out the back door here, yeah.
So that's high on our priority list, and really it's just going to come down to everybody wants to get this done. We're all on the same page. We're just trying to fine tune the details of where we're going to get the money and how we're going to pay for it.
Yes, because I walk out there every morning at 4:45, so it's.
Well, we don't want you falling.
No.
We have to take care of this.
So it's
got to keep you upright.
Yeah, that's it. Exactly. So anyway, great, Ryan. Well, that's great. I think everything is. You're settling into the job, and I know your time is at a premium. Everybody's biting at your ankles here, so to speak.
It's a lot of emails, that's for sure. A lot of emails.
Absolutely. So anyway, that if that's all you got, we can throw it over to Russ. And Russ, what's the state of the Chatham Health District now? We've got all of the mask mandates are kind of being rescinded one by one. So give us the state here.
Yeah. So COVID-19, we're at what I would say is perhaps the period of greatest uncertainty since the pandemic first emerged in March of 2020, where we really were full of uncertainty about everything.
Right.
And I say that because we're coming down off what has been the biggest by far wave of infections and hospitalizations of the pandemic. Thankfully, vaccines managed to blunt the fatalities. So we did see quite a few, but not nearly as many as we have during other waves. But we're coming down off this big wave, and a lot of people got infected. Not too many people got very sick. Most people are vaccinated. In the town of Portland, if anybody's curious, of the total population, almost 84% are fully vaccinated, and that includes people who can't yet be vaccinated, those people under 5. So vaccination rates are very high. Not many people are getting very, very sick, but infections continue to be very, very high. Right now, we've got more infections now than we did during the peak of last winter.
Really?
And that includes, now that we're using, doesn't include results from at-home tests. So think about that for a moment. I bet everybody right now is sort of starting to breathe a little bit of a sigh of relief because it starts to feel like things are getting much better. And they are. But that's only because we've been down a pretty dark path during the Omicron wave.
Yes.
And nobody knows if this is the last pandemic wave we will experience, or if there will be another variant that will emerge that will cause another pandemic wave. And I think more than that, the sentiment around, sort of the idea of getting back to normal seems to be more prevalent than it was at any other point.
Right.
In fact, I think the polls show that roughly 70% of Americans report that they think we should, quote unquote, try to get back to normal now.
Right.
Whatever that means. That might mean different things to different people. But the public sentiment seems to be that this is something we can now live with. Omicron seems to be less deadly. When you're hospitalized for a much shorter period of time. You tend to need less intensive care. Much less likely to die. Vaccines work pretty well to keep people relatively healthy and well, even when they're infected. So, but nobody knows what the future is going to bring. But generally speaking, my feeling on this is we don't know what it's going to bring, and so I think we need to be guarded against that. But maybe it is time to start considering, a return, so easing back on some of these restrictions, with the understanding that, if things get bad again, we should be prepared to reintroduce some of these restrictions, masks included.
Right. Right.
So there's just a lot of uncertainty. There's just a lot of uncertainty, and that's coupled with a lot of exhaustion. The big question right now is, what do school districts do? The governor announced that the statewide requirement for schools to have masks for everybody who enters the buildings is going to be allowed to expire as late as February 28th. But if the legislature doesn't extend that executive order through the end of the month, then it will cease, on the 15th.
Right.
Of February. So that's going to be, and it's going to be passed to local decisions. And so all the superintendents in the state, including school boards, boards of education, are having these conversations right now. And there are varying degrees of eagerness and trepidation around, how to approach masking in schools. From my perspective, we're in this situation where we've been told by the CDC that the regular old loose-fitting cloth face coverings that people were making themselves in their homes in 2020 no longer provide a comfortable level of protection given how transmissible Omicron is. So we're hearing that those masks are really not particularly well-suited to protect people from Omicron. They do something, but not as much as they had been. So CDC is recommending people consider higher level filtering face pieces like N95s and KN95s and KF94s, which for anybody who's worn those knows they're not the most comfortable thing. And moreover, they're not recommended on a population level for children because they've not really been evaluated in children.
Right.
Heretofore, they've really been for industrial use by adults, in healthcare or in occupational settings where there's a lot of, particulates in the air, they do a pretty good job filtering, but that's adults. So we don't really know how well children, especially young children, might deal with these things. So, my recommendation, first and foremost, to anybody who's got a child, especially a young child, who's thinking about these masks, is talk to the doctor about it.
Yeah.
Speak to your doctor about it before you start putting those masks on your child, because you don't know what the risks might be.
Sure.
So we're in this situation where the cloth face masks that most kids are wearing right now aren't as effective as they used to be. And so if we're telling kids to continue to wear those masks in school, how effective are they?
Right.
So that goes into the uncertainty around mask policy. And the other thing is, at least every child who's at least 5 years old or older has had the opportunity now for several months to get vaccinated.
Sure.
Parents have had the opportunity to vaccinate their children. So, what is the goal of an intervention like wearing masks? Is the goal to try to prevent every last infection? Is the goal to try to prevent, infections that result in serious disease? Well, we also know that most children present with much milder infections.
Sure.
Especially children who are vaccinated tend to, it's a vanishingly small number of children who are fully vaccinated that will end up having a severe outcome, ending up in the hospital.
Right.
And that includes children with all sorts of underlying conditions like asthma, which is the most prevalent among children.
Sure.
So what are we talking about preventing when we're talking about these interventions like universal masking? So I think that there's this uncertainty. And the other thing is, we've been living with Omicron, though it seems like forever. It's really only been a couple of months.
Right.
And so all the studies, all the evidence around the use of masks in schools and masks in community settings and businesses, everything that the CDC has been pointing to say that masks work, it doesn't include studies that look at how they work with Omicron in those settings. So we're talking Delta, Alpha, and the original variant. That's where all the evidence is around masks.
Right.
And masks in schools specifically. So we don't have all the information in public health terms that we really, really want to have at our disposal to make a very well-informed recommendation around masks in schools.
Right.
The CDC still recommends masks in all K through 12 schools, universal masking. They still do.
Yep.
I believe the Connecticut Department of Public Health, when their guidance comes out, which we're all waiting for, will have a similar recommendation. Universal masking in K through 12 schools. They'll have some options to say, if schools decide to not go with universal masking, here is what we recommend.
Right.
So there will be some things in there. But we really just don't have all the great data that we need from Omicron in schools. We can look to the South, for example, and say, well, across the southern United States, they haven't had mask mandates in schools for quite a long time. And they dealt with Omicron. But they didn't have masks in schools at the outset and throughout the Omicron wave. So we did see early on many schools across the South deal with major outbreaks of Omicron. Some had to close because of so many students and so many staff were out with illness.
Sure.
That they couldn't open the schools. But that was during the peak of Omicron. So we're past that here now, right?
Yeah.
We went through and we have gone through the worst of the Omicron wave. And so looking to the South to see what schools look like without masks when we're already in the back end of this wave isn't particularly helpful. We can look at it and say, well, we would expect to see more transmission, but we simply don't know how much more. And so we just don't, there's just all that uncertainty, which makes me, as the health director, a little bit cautious. So, my recommendations at this point, if I were pressed, would be for schools to consider extending a mask mandate for a couple of months. Just A, until we get past the worst of the Omicron wave, and B, there will be some early adopters in the state of Connecticut and in places like New Jersey and Massachusetts. There are a number of other states in the Northeast that have now or are in the process of removing the mask mandates in schools. And I, for one, don't like to be such an early adopter of these things. I prefer to say, well, let's look to see what happens with some of these early adopters.
Sure.
Are they going to see major outbreaks? Are they going to see spikes in hospitalizations among young people? Or is it going to continue to decline as though nothing's happening, as though nothing changed? That would be fantastic. I'd rather look back and say, yeah, we could have done it a little earlier, but we were cautious, than say, well, we did it, we were an early adopter, and then we saw a bunch of kids get sick. So that's where my head is at around school masks. But I don't necessarily think universally we should always have masks in schools. I don't think that is where we need to be, forever and ever. Or for even a long time.
Right.
Because quite frankly, again, there are some things that we won't know until we do it.
Right.
Which is kind of a scary thing for families. It's a scary thing for administrators. It might be a scary thing for kids.
Sure.
But that is simply the truth. We may not know exactly how Omicron in Connecticut on the back end of this wave is going to behave in schools without masks.
Sure.
And anybody who tells you different is not telling the truth.
Right. Well, and just so you know, in a few minutes here, we're going to have Dr. Britton be coming in and doing the school podcast, so we're going to get a sense of where his his board is at, and if you're more than welcome to hang around if you want to do that. As far as
well, actually, I was on a call with Dr. Britton yesterday with his reopening committee.
Yeah.
So I was on that call, and everything I just shared with your listeners just now, I shared with
Dr.
Charles, and I shared with the other members of the reopening committee, including I think Ralph Zampano, who's on the board.
Yes, he's one of the board of selectmen.
So I don't want anybody to think that when public health makes recommendations that we are certain about these things. There is some inherent uncertainty here,
sure.
And especially right now, which is why you're hearing some caution.
Right.
You are hearing from public health officials, including me, I'll say, that we can start to move cautiously towards some kind of return to normalcy. But I say cautiously. So
right.
That's all. That's where my head's at around these things.
Well, I think from a standpoint of the state, I think the governor is going to be rescinding a lot of the indoor mask mandates throughout the state, and is it at the end of the month or this week or something?
Yeah, I think at the end of the month. So right now, there's a mask mandate for people who are unvaccinated in all the indoor spaces, and we know that's by and large not really being enforced because nobody's asking to see anybody's vaccination card when they come into an office building, for example.
Right.
That's mandates in place, but when it expires, I think we'll notice very little different, except people will start taking signs down, at the door that says unvaccinated people must wear masks.
Right.
So that'll be the only change we'll really recognize, and we'll take a look at the numbers and see, when these things change, do we see a plateauing of the decline of the Omicron wave? Mm-hmm. Or do we see it continue to come down very sharply, as it has been over the last few months?
Right.
If we see a plateau, then we'll know, okay, we may be seeing the effect of rescinding all these mitigation measures.
Sure.
And that's just something we'll either decide that we're going to live with or not. Which brings me to another point. I mean, you hear a lot of people talking about pandemic versus endemic, right? Like, are we moving to a point where COVID-19 is just an endemic disease because we're not going to get rid of it absent vaccines that are much, much better at preventing infections, which our vaccines, unfortunately, now are not. They're great at preventing disease, but you can still get infected and get a little sick. So endemic, simply the difference between an endemic disease and something that is not endemic, that we might consider pandemic or episodic or whatever, is our level of tolerance. It's actually more of a social question than it is any question of epidemiology or numbers. We can have an endemic disease that causes a lot of disease and a lot of disability and a lot of death. I mean, you can look at malaria, for example. That's endemic in parts of Africa. It kills, 500,000 children every year, but it's endemic. I don't think anybody would argue we want something like that, but we've got Lyme disease, causes quite a bit of disease in our population. That's endemic. We tolerate it. We don't have, for example, requirements that whenever you enter a park, you have to wear long pants and tuck your pants into your socks so you can't use the trails from May to October, right?
Right.
So the word endemic, what we frame this disease as, is simply a matter of the public's ability to tolerate however much disease and disability and death it causes. That's it.
Right.
And that's public policy. I mean, Ryan knows he's into public policy now. Public policy accounts for the importance objectively, like the severity of something, the frequency that something is occurring with, and public sentiment.
Yeah. And public sentiment right now is playing a big role in a lot of the decision making, because everybody realistically is COVID tired,
That's right.
And that is going to play, partly into a lot of, for a better word, politicizing a lot of the things as far as that goes. So, you
have to make public policy, and politicians make public policy. Elected boards make policy. Public health will have recommendations. My recommendation would be to keep masks on kids, but at the same time, Chatham Health District is not a policy-making agency.
Right.
We issue public health recommendations. And, that's it. But public policy takes into account more than just, public health recommendations.
Right. Well, that's the way it is, I think. And again, it's living with it and defining the new normal for what that might be.
Right, but again, we need to be ready to deal with the next Greek letter in the alphabet if it happens, and there's no telling what that could bring. It could bring something that is even less severe,
right?
Less transmissible. It probably wouldn't be less transmissible. It would have to be something more transmissible,
right?
And having an ability to sidestep our existing immunity, whether from natural infection and recovery or from vaccination, to really take over Omicron. And no, there's no telling if it's going to become seasonal, if it's going to be, we're going to see 2 waves every year for, the next 10 years.
Sure.
We don't know how the virus is going to evolve or if it's just going to stop. I
Yeah.
mean, we really have no idea.
Right.
So I think everybody who's exhausted, just be prepared to see what happens next and be open to, things getting better and feeling great, and maybe things not getting better, things
Right.
getting worse, and just be prepared. So
What
that's COVID-19 in a nutshell right now. It's just a period of uncertainty. And, I want to give everybody out there who's listening permission to feel whatever they feel around the risk involved in what we're talking about.
Sure.
Because everybody has a different personal comfort level with the risk.
Sure.
And we can measure risk and we can describe risk as we do in public health with numbers.
Yeah.
But everybody's going to look at those numbers and feel a different way about that risk, and then therefore feel a different way about what we as a society should do to mitigate that risk.
Sure. Well,
So
that's
be respectful. That's all. Be respectful in the dialogue as we move through this transition.
Sure. What's the status on the oral pills right now?
So there are a number of really good medications out there. I think the best one is the one that's manufactured by Pfizer. And that is, an oral medication that's taken early on during the course of disease. There's another one by Merck that's a little bit less effective. Both are available only in small numbers. So right now they're not widely available. Manufacturing hasn't yet really caught up with what would be the demand, but it's out there. So if you are somebody who especially is high risk, who ends up testing positive for COVID-19 and has symptoms, don't delay. Reach out to your doctor and ask if they can prescribe you, or if it is appropriate for you to be prescribed either of these oral medications, because they could be taken in the comfort of your home, as opposed to the previous treatments were really monoclonal antibody treatments that people were getting.
Yep.
And there's some they have a diminished effect right now with Omicron.
Right.
So those pills, the Pfizer one, I think is 90% effective at preventing hospitalization. I mean, that is tremendous.
Now, are those okay for children to take, or?
I don't know, actually. I don't know if they are prescribed for children. I think, most children aren't going to be categorized as high risk. So even if they are, for example, authorized for use in the pediatric population, I don't know how many physicians would look at a child unless they had some serious immunocompromising condition,
Right.
and say they really warrant being prescribed these right now, hard to come by medications. So I don't know the answer to that question. But there might be parents out there who are thinking, well, my child has an immunocompromising condition. They attend public schools. They've been vaccinated, but I know that the vaccine may not be as effective for people who are immunocompromised, including my child.
Right.
And if the masks come off, I don't know if I feel safe sending my child to school.
Right.
There are likely some parents out there who fit that category.
Yeah.
And in terms of medications, there is a monoclonal antibody that is indicated for pre-exposure prophylaxis.
Okay.
And it is very effective. So what that means, and it's for children as young as 14, not younger. I forget the name of the monoclonal antibody, but it's given it's an injectable. It's given to the patient, and it provides pretty long-lasting, many months of protection for moderately to severely immunocompromised people.
Oh, okay.
So essentially, if you're somebody for whom the vaccine might not be very effective because your body can't mount a sustained immune response after exposure to the vaccine, you can get this monoclonal antibody, and it provides you sort of similar level of protection that the vaccine would.
Right.
If you were somebody who could mount a proper response to the vaccine. So that's a monoclonal antibody. And so for anybody out there who has a child as young as 14 who is immunocompromised and there's some concerns around whether the vaccine is protective, and you have to send your child to public school and you're worried about masks coming off, speak to your child's physician, or if you're a teacher, and you fit that category, right?
Sure.
There are teachers out there who, work in schools and might be worried about masks coming off. Speak to your physician or your child's physician about this monoclonal antibody treatment that is used before exposure, not as a treatment after illness develops, but before exposure.
Right.
So we have all these other tools in our toolbox now. Vaccines on the public health side, these new treatments on the treatment side after somebody gets sick, or the pre-exposure prophylactic treatment that we didn't have last year. We didn't have at the last peak. So I think we're kind of in this space where we're starting to get a handle on how we manage this a little bit better. Vaccines are pretty effective. We have treatments. Some of the cloth masks are known to be a little bit less effective, and so why are we continuing to wear them? And that's an appropriate question to ask.
Yeah.
So this just big transitional period right now.
Sure,
Dave.
sure.
Just really transitional.
Any other thing, Russ? And you'd probably have a better sense than I, but do you think the big educational campaign that was thrust into the media and so forth, did that help in vaccinations?
We saw a very, very small sustained increase in vaccine initiation and people getting fully vaccinated, but it was almost imperceptible, Dave.
Oh, okay.
I mean, for all the starting as far back as July, the federal government trickled down to the states, pumped a lot of money into vaccine campaigns, vaccine education, getting vaccines out into communities, to vulnerable communities. We participated. We were at all kinds of public events over the summer and going all the way up into November.
Right.
And for all that effort, we saw a pretty small benefit. Right. So, and it's been like that for quite a while. We've just been seeing a small uptick in vaccinations.
Right.
We may see, if mask policies change, we may see that impact, especially parents of some young kids. Right now, the lowest vaccination coverage is among children 5 to 11 years old.
Yep. Mm-hmm.
It's pretty low. It's well under 50%, for, I think, statewide, it's somewhere around 30%. It's pretty low. Mm-hmm. And so there may be some parents who are looking at masks coming off and thinking, okay, maybe it's time to get my child vaccinated. And I would say to those parents who are thinking about that, yeah, you really should consider getting your kids vaccinated.
Sure.
Because, despite the fact that most young people have a pretty reasonable course of infection when they get infected, even if they're unvaccinated. There is a risk of some pretty rare but serious complications from COVID-19, especially with young people, called MIS-C, multi-system inflammatory syndrome.
Okay, yeah.
And we have seen over the last couple of months a pretty significant spike in reports of MIS-C.
Yep.
And that's a pretty significant outcome for those kids.
Sure.
So I think that parents of young kids should weigh the benefits of the vaccine in preventing some of those rare but serious outcomes against the very mild risks associated with vaccinating children, and take a hard look at it and get your kids vaccinated.
Well, great. Well, thanks, Russ, for the all of the info and so forth. So I think that is very informational for our listeners. And again, I appreciate you coming on and giving us the update and so forth. And we're going to get. Like I say, Charles is going to be coming. In fact, he's out in the green room right now.
Okay, great.
So forth. So, anyway, Ryan, you got anything else to add before we wrap it up here at our episode number 47?
No, I think we covered it. Thanks, Russ. It's a lot of great information.
So great.
Yeah, happy to be here.
All right, Russ, thank you so much. All right, ladies and gentlemen, that wraps up our episode number 47 of the Town of Portland podcast. And again, our host today, as always, is our first selectman, Mr. Ryan Curley, and our kind of our frequent flyer invited guest, Mr. Russ Melmed from the Chatham Health District. So stay safe. The news is coming out as far as the max update, and we're going to be doing our Portland Public School podcast very shortly, and Dr. Charles Burton is going to be giving us all of that update. So thanks again. Stay safe, and good luck with your Super Bowl picks this weekend. So thanks so much. Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.